Great. I'm Liz Howard. I'm Director of Midwifery at Women and Infants Hospital. I've been a midwife for 30 years, and I can probably talk a little bit about some of the cost savings. The United States ranks higher in healthcare spending than any country in the world. We spend more on maternity care than any country in the world, yet we rank 60th for maternal mortality. So why do we spend so much money and have such poor costs? Because we over-medicalize normal birth. We underutilize interventions that have what's considered level A evidence. Level A research evidence being that there's been lots of randomized controlled trials on it. Doula care is about the only level A evidence we have in obstetrics, yet we really underutilize it. It is clear that continuous presence of support personnel, such as a doula, decreases cesareans, improves the birth experience, decreases all types of medical interventions. So right there we have a cost savings. At Women and Infants, we launched with a Reducing Primary Cesarean Collaborative, and we train our nurses to do one-on-one labor support. That is not the same thing as having a doula present, because nurses have other tasks. So having a doula on the team really assures that continuous presence. In the Reducing Primary Cesarean Collaborative, Bay State Medical in Springfield, Massachusetts actually costed out what the savings is per C-section averted, and it's $7,000 per C-section. So a lot of hospital costs are in the length of stay. So the average length of stay for a cesarean delivery is 3 to 4 days, and for a vaginal delivery is 1 to 2 days. So length of stay costs are really significant. The United States is 32% overall for C-section. Our vaginal birth after cesarean rate in this country is 13%, which is truly atrocious. Support with a doula could really improve that. There are lots of factors related to who gets a vaginal birth after cesarean. A local person just defended her dissertation that I went to the other day. You're 80 times more likely to have a vaginal birth after a C-section if you go to a midwife. So I think the same would be true of a doula. So the cost of childbirth care in the United States exceed any other country. The benefits of doula care are well documented with no known adverse effects. Expanding doula care has the potential to decrease spending on non-beneficial obstetric procedures, lower cesarean rates, and reduce the rate of interventions overall. The presence of a trained doula is considered grade A evidence in obstetrics, meaning it is well studied in randomized controlled trials. Facilitating doula care, particularly in hospital settings, has the potential to improve client-led, team-based care, birth outcomes, team experience. It is great when there is a doula on the team. I think it lowers the stress of everybody on the team. I mean, they're not just great for patients, they're great for providers. I love having them. In particular, community-based doula programs provide culturally congruent care and access for those most at risk of poor outcomes, health outcomes. So I heartily endorse this, and thank you all for being so supportive.
So were you here when I talked about starting to present data, either annually or otherwise? So some of what you're presenting could be
absolutely
evidentiary at some point.
Yeah, absolutely.
So be prepared, that's all.
Absolutely, happy to do it anytime. And I have written testimony both from the Rhode Island affiliate and